Welcome back to Senior Support on Your TV. Today we're talking to Stacey Daub. Stacey is the CEO at Quinte Health. Now, Stacey, we see over your shoulder there the logo. It's Quinte Health. It used to be called Quinte Healthcare Corporation, or QHC. And I know you've gone, you and your colleagues at the hospital have gone through quite a process to change this and have a different logo. Maybe you could tell us a little bit about it.
Sure, I'd be happy to do that. So last year we took on a strategy endeavor where we really wanted to talk to the community about the future of their hospitals. And we developed a whole new strategy that was very people-centered, human-centered. And we kept coming back to our name and our logo. And we didn't find it to be extremely people or community-centered. So we went out and talked to our community about what they thought, and they thought around the same lines. We are in the human care business. We are not in the corporate business. And so that was one piece of feedback. The other one is a lot of people didn't know what QHC was. What is a QHC? It's a kind of an acronym. Lastly, I think what was really clear is that we really wanted to make sure that all four of our hospitals and all four of our communities were represented and connected through both our logo and our name. So that was all the background to evolve and update our name. So I'll describe it a little bit. So Quinte Health is intended to really mean that we want to think about not only the health of our population, the health of our patients, but also the health of our community. So much broader perspective than a very narrow focus on hospital services. And I think in our earlier interview, we've been talking about that, right? The role a hospital can play in terms of trying to help and support a stronger primary care system, a stronger community care system. So we want to think about health more broadly. We also think that it's more than healthcare, right? Healthy communities mean more than healthcare. They mean having places for recreation. That means having insurance that people are not living in poverty, that they have access to education. So it's a much broader concept. So that's a little bit of the background around the Quinte Health name. And then the logo is really a representation of our four communities coming together and working together. So each of the chevrons or arrows represents one of our communities or hospitals, and the four of them together represent how we want to work together in service to our community. Some people may see this. I didn't when I first saw the logo, but right in the middle is a bit of a cross, which is the universal symbol of a hospital. So the new logo is really intended to show our four hospitals, our four communities working together to advance what we're calling our new purpose, which is creating healthier communities together. So that's a bit of background. I'm very proud of it. One thing I think is important for people to know, we did not spend a lot of money on this. We actually did a lot of the consultation services and then used a local company to help us. So it was very economical. And we intend to change the signage and those things over time when it makes sense. So if we're going to develop a new website, we would then incorporate the new branding. Trying to be very smart about that and very economical, I guess you would say.
Mm-hmm. I attended a workshop that Quinte Health put on, and you explained it then, Stacey, and it really resonated with me. And I did see the cross right away when I looked at it. And so I wonder, what's been the reception in the community? Do people find it helpful?
Yeah, so let me start with a couple of different groups. So I would say in our staff and teams, I think it's really resonated. Quite honestly, some of them have said, if we were still wearing the same clothes we were wearing 20 years ago, maybe, and so it's contemporary, it's colorful, it's bright, and it really shows the four hospitals. So for a lot of our teams and staff, and we've gotten a similar reception in the community, that it just is updated, contemporary, and really beautiful, actually, the four colors. I'll tell you a little story about the background for the four colors. So their inspiration really was, we went back to see the origins of some of the communities and their flags. And so it's kind of interesting that Trenton had a blue flag, Belleville had a yellow flag, and Picton or Prince Edward County was red, perhaps a homage to the Loyalist history. There wasn't anything for North Hastings, so we added the purple, and the colors aren't really supposed to represent each of the hospitals, but the background really gave the I think a bit of inspiration to come up with the colorful logo that represented the 4 hospitals and 4 communities.
Mhm.